Just tell me when. You ready? All right, you got Josie. Mic check 1 2 3 4 5 6 7 8 9 10 from the South Carolina State Emergency Operations Center. Mic check 1 2 3 4 5. Good. And you got Josie in the shot. Excellent. All right. Okay. Thank you.
Well, y'all, thank you for coming. Today, again, we are trying to be sure that everyone is kept up to date on the progress of the virus and the progress of our efforts to fight that virus without destroying jobs and families. So today I'm issuing another order. This is a mandatory order. We've issued several that contain mandates and others that contain recommendations. Today, most of those recommendations are becoming mandates, becoming orders with criminal penalties attached. I'm issuing a mandatory home or work order, a home or work order that goes into effect tomorrow afternoon, Tuesday at 5:00 p.m. to close the business. Everyone under this order, everyone should stay home unless they're working, they're visiting family, or recreating outdoors, unless they're obtaining necessary goods or services, and those are the limits. We are closing no additional businesses. Those businesses have been closed in previous orders. Also, we're requiring mandates of the retail stores that are open, and that is they must limit the customers. We must have social distancing in these stores, and that specifically is no more than 5 customers for every 1,000 square feet in a retail business, or 20% capacity, according to the fire marshal, whichever is less. A violation of any of these mandatory requirements is a misdemeanor, 30 days in jail and or $100 fine for each day of violation. Why are we doing this now? Why not wait later? Why not have done it earlier? That is because it is time, according to the data, according to the science, according to the facts, and according to the expert advice and guidance, as we have explained before, it is now time to make these recommended actions required. Why is it time? Because too many people, from the statistics, from the facts, from observations, too many people are on the roads, too many people are on the waters, too many people are in the stores, too many people are not complying with our requests concerning social distancing. We've asked, we've urged, we've suggested, the experts have suggested, everyone is aware of the information that we have disseminated, but the last week or so has shown that it's not enough. The rate of infection is on the rise, and the rate of noncompliance is on the rise. We hope that this order today will reduce the rising rate of infection and also reduce the rate of noncompliance and also reduce the number of people who are losing their jobs because of these necessary orders. This week, ladies and gentlemen, we had over 200 this week. By the end of this week, we expect to have over 200,000 people who have applied for unemployment insurance in South Carolina. That's just the tip of the iceberg. Each one of those 200,000 people likely represents a family. And we know there'll be more. We know there are many more than that have lost their jobs, either because of the market, because of steps taken by businesses and services, or by the orders that we have issued. All of those people have to pay bills, they have to feed their children, they have to save for college. There are many things that people will not be able to do because of these orders. It'll be difficult at the least. So we must be aggressive in going after this virus, but we must seek to do as little damage, as little destruction to the homes and the businesses and the people and the jobs as is possible. Finally, as for the General Assembly, as you know, we have to have a budget, we have to have laws, we have to have business done in the General Assembly. So I am urging the General Assembly to come back to work on Wednesday, as has been planned, and get it done. We have cashiers going to work. We have police officers going to work. We have all kind of people going to work. There's no excuse for the members of the General Assembly not to come to work on Wednesday and take care of this vital business. And finally, again, on Easter services, we recommend that those services continue, of course, but we urge the churches and others to stream on the internet if they can, to meet outdoors if they can, and if they can't do those, please provide for that social distancing in the church. Now, speaking of Easter, would the chaplain please come forward?
I want us to remember a few words from the preamble of the Constitution. That says, "We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity." If you would, please pray with me if you're a praying person. Great God, you are a God of unity, a God who requires us to love justice, and who longs for peace and mercy amongst his people. During this time, help us, we the people of the United States, continue to love one another, serve each other, and let the spirit of South Carolina and America shine through us all as we patiently obey and pray for the leaders over us and pray for the healthcare workers and other servant leaders selflessly tending to our needs. I pray all these things in your mighty name. Amen.
Dr. Bell.
Thank you, Governor. Good afternoon, everyone. We are reporting 183 new cases of COVID-19 as of today, which brings the total number of people confirmed to have the disease in South Carolina to 2,232. Over the last week, we have seen an accelerated rate of new infections. In South Carolina, an average of 187 new infections per day have been reported in the past week. That is an increase from an average of 90 new infections per day being reported in the week prior. We recognize the hardships that are facing many South Carolinians as we continue to respond to this public health threat together. I want to reassure the public that we are working hard together as a team from the local, state, and in concert with our national partners to protect the health and safety of all South Carolinians. And as of today, we continue to work with healthcare facilities to stay updated on the availability of acute care beds throughout our state. And currently, we are at 51% capacity. A total of 21,384 tests have been performed by both the DHEC Public Health Lab and private labs on South Carolinians in our state, of which 2,232, or approximately 10%, have been positive. While our state's public health laboratory has no delay in testing, private laboratories around the nation have significant delays, which would indicate an even higher number of cases yet to be reported, and we should also include individuals who may not be tested. We are working to avoid the problems that the most impacted areas are seeing related to the stress on the healthcare system, including hospitalization rates, ventilator availability, and others. And we are doing this by prioritizing our limited resources. Our current data shows us that social distancing and staying home helped combat the spread of disease and ultimately save lives. However, while these hard-hit areas of the country are continuing to have significant daily mortality, it puts us in the best position if we plan for the worst. The daily case counts in some of those areas is improving due to strong mitigation efforts, and we've worked in consultation with the governor to implement effective measures to slow the spread of the virus. Our ability to combat the spread of the disease will depend on the actions that each of us takes. This is a historic and unprecedented event, and how we respond as individuals, a community, and a state will be remembered for generations to come, and we ask for your continued support for following the guidance of public health professionals so that we can continue to fight on your behalf. Please do your part, stay at home, and limit close contact with others. And as always, for the latest information, please visit our webpage at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Davidson. Mr. Davidson, Director Davidson.
Thank you, sir. Thank you, Governor.
I'll briefly cover a few items that will be posted on our website later today, both an explanation and a video. Earlier this weekend, the CDC released information regarding the use of cloth masks and face coverings. While these measures are optional, they may help reduce the spread of the virus. They are not intended to replace social distancing or hand washing or any of the other recommendations intended to protect health. South Carolina residents should not run out and buy masks. As a reminder, the CDC has warned that this is a historic and unprecedented outbreak and that supplies are limited. It is important that we save the manufactured masks, be they surgical masks or N95 respirators, for doctors, nurses, and first responders who may need them most. Homemade masks may reduce the amount of virus that one breathes out and may prevent one from touching the nose or the mouth. This measure is recommended to be used in situations where social distancing may be difficult to maintain, such as grocery stores, pharmacies. It's intended to protect others from those who may be infected with the virus and able to spread it but not yet showing symptoms. People wearing masks should not feel a false sense of security as well. This means that masks should be worn to help protect others. It's important to understand that these recommendations do not allow for someone to go out in public if they are ill. They still need to practice social distancing, stay at home if you're ill. Individuals with symptoms should continue to isolate at home, but may consider a homemade mask when leaving to get medical items if a homemade mask is all they have. Again, we will post on our website instructions and a video for making a homemade mask. It's quite simple. All you need is a piece of fabric. You can take the fabric and fold the fabric so that it fits over your mouth and nose. On one end of the fabric, you cover it with a rubber band about 2 inches from the end of the fabric. You do the same on the other end of the fabric, about 2 inches down. You then overlap the fabric on either end, grab the rubber bands, and then pull it to the nose and mouth. Again, that video or a video similar to that will be posted on our website, as well as written instructions as to how to make a homemade mask. Thank you.
Thank you. Adjutant General McCarty. Sir.
Thank you, Governor. Since the announcement of the Governor McMaster's executive order issued on March the 17th, the South Carolina National Guard has been working with a strong coalition of personnel comprised of various state and federal agencies and our healthcare professionals here in the state of South Carolina to determine the possible impact that the current COVID-19 response plan could have on our healthcare system here in the state. We have implemented a scalable, tailorable, tiered response to increase the bed space, staffing, and other support services needed to operate a medical facility. And I'd like to briefly discuss what our analysis has revealed and the fundamental aspects of this plan. This tiered response plan is intended to operate within the existing hospital healthcare system in the state. It merely expands the hospital footprint outside of the existing hospital facilities. I'd like to recognize some of our participants that have been a part of this process. South Carolina Emergency Management Division, South Carolina Department of Health and Environmental Control, South Carolina National Guard, South Carolina Hospital Association, South Carolina Labor Licensing and Regulations, our regional health care providers, South Carolina Department of Transportation, South Carolina Parks, Recreation, and Tourism, and the South Carolina Department of Administration. All of those, in addition to others, to include the Army Corps of Engineers, have been a part of developing this plan that we are prepared to begin implementing as of now. As we have heard from reports from Dr. Bell and others from DHEC over the last couple weeks, that this pandemic is an ever-moving target. When I say that, the projections and the numbers that we're looking at have changed, and we anticipate they will continue to change. But for planning our initial plan, which is, again, scalable and tailored to the needs that we may have, our early projections have it that we would have approximately 3,500 potential COVID patients here in South Carolina that could need hospitalization in the early part of May. Again, we will each and every day look at the projections, we will look at those numbers, and we will adjust the plan as necessary to be sure that we're capable of handling the response plan as identified that we will discuss here. Based on today's numbers, you can see the hospital bed space capacity in the state by regions, in the PD, the upstate, the Midlands, and in the low country. You can see the numbers that are currently beds that are used and the current beds that have been made available. And we have noted in the past that the hospitals have reduced elective surgeries and other procedures to allow that capacity to be there, and we appreciate their efforts to do that. In addition, as we look at it, you can see the number of intensive care capacity we have, the beds that are currently being used for ICU patients and those that are available, and the number of ventilators that are being used and those that are available. Again, these numbers will change potentially on a daily basis, and we will always monitor those to ensure that our plan accommodates those. As of today, we have 5,944 hospital beds that are available here in South Carolina. What our plan will allow us to do is to add an additional 3,000 beds to give us an approximate number of 9,000 beds no later than May 5th of this year. From that planning projection standpoint, in our first phase, by April the 28th, we will add 1,500 beds in either a Tier 1 or a Tier 2 capacity. And we'll speak a little bit more into that detail as to identify what a Tier 1 and a Tier 2 facility will be comprised of. By May 5th, we will add another 1,500 beds that will give us that 3,000 bed capacity above and beyond what we currently have available. Some key takeaways from this, just want to say that this is a contingency plan. This is a plan that we will have in place, ready to go if those needs do develop. It's a plan that's built around the current hospital system that we have in the state, in the upstate, here in the Midlands, in the low country, in the PD, and throughout the state. It is a plan that has been vetted by the South Carolina Hospital Association and by the Office of Rural Health, where they have gone and talked to all the leadership in every hospital in the state. Those members of the leadership have indicated that they understand the plan, they believe the plan is workable, and they support the plan, which I think is very important. I will now like to have Dr. Eric Osmond to come and speak to talk specifically how our tiered plan will be implemented. He is the Vice Chair of the Department of Emergency Medicine and Chief of Preparedness and Emergency Management with Prisma Health. At this time, Dr. Osmond.
Thank you, Adjutant General. So what I wanted to do is just build upon what the General has said about the tiered response plan. When we envisioned this plan, it was to really extend the capacity of our existing healthcare system. We're not making anything new or novel. These are simply extensions of the existing systems. So over the last 3 weeks, we've been working with the South Carolina Guard, with the Emergency Management Division, with the South Carolina Hospital Association, and all of our other clinical partners throughout the state to come up with a workable system that is going to give us the bed capacity that we could potentially need. So this is a 3-tiered system, and as I'm sure you're very familiar with, the Tier 3 hospitals are your traditional hospitals. They're the hospitals where we provide critical care services. They're the hospitals where we're able to provide ventilatory management to patients that are very sick. And the role of these hospitals is not going to change. These are going to be the facilities that are going to care for folks that are sick from COVID-19, but they will also continue to care for people that have all of the regular illnesses and injuries that people in South Carolina will encounter. So when we look at the additional expansion, we're really talking about Tier 1 and Tier 2 hospitals. And so the idea behind these hospitals is that we will use them to provide treatment within their scope. So we're going to be in the Tier 2 hospitals providing care that is appropriate for those patients. It won't be as intense as we're going to provide in Tier 3, but it will be professional, high-quality care on the level that South Carolinians will expect. The Tier 1 facilities we're really using for quarantine and isolation of folks. As you know, with COVID-19, one of the most critical things is that people are isolated from others when they're ill, and that people that are high-risk contacts are quarantined and away from others when they're potentially infectious. So when we talk about these medical surge facilities, what we're really talking about is opening some of the shuttered hospitals, creating Tier 2 facilities in coliseums, in arenas, and then also creating tent hospitals if needed. So all of these are options on the table for the Tier 2 facilities. The Tier 1 facilities are really designed for people that are going to be able to provide self-care. So these are not folks that are going to require intense medical treatment. They will require self-care, and we will have a light medical footprint at the Tier 1 facilities to assist and to monitor those patients. Should they become worse, they'll be transferred as they would during any other event to a regular Tier 3 hospital for evaluation and treatment. So we believe that this tiering of our hospital resources will allow us to increase our capacity and serve our patients appropriately and safely during the COVID-19 pandemic. Thank you.
I would now like to ask Dr. Pat Cawley. He's the CEO at MUSC, and in his position there is the Vice President for Health Affairs, where he will discuss some of the staffing challenges that we face as we work to build this surge plan. Dr. Cawley.
Thank you, General Governor. This plan, on behalf of actually all South Carolina hospitals, I just want to briefly state that we feel we are ready. I want to support what Dr. Osmond said in terms of all hospitals have been surveyed in the past few days, and every single one of those hospitals is supportive of this plan. It is easy to support because this is a mere extension of what our normal emergency operations plans are. In normal emergency operations, we are ready to surge. This one may be a little deeper and a little greater of a surge than usual, but we are ready. I've seen a lot of work across South Carolina hospitals over the past 4 weeks, and I am confident that we will be ready. On behalf of MUSC, we know this is going to be tough. This is not going to be easy. We have a hospital that normally has about 800 patients in it. We are ready to surge that hospital approximately another 150 beds. To go beyond that into the second level facility, we are going to use our fitness center, which is about a block away from the hospital, to surge another 250 beds if needed. Once again, this will not be easy. This will require a different level of personnel and how they are used, but we think we are ready. We've been planning and planning hard. This is going to take our nurses, our frontline doctors, our residents, our fellows. This is going to take an entire team to take care of these patients, but I feel confident that we are ready. It'll be a tough month. The surge is likely to last a while. It won't go away right away, but I think we can pull it together, and I'm confident that based upon what I'm hearing across all other South Carolina hospitals, that those hospitals be ready to work individually as well as together. So once again, I think the message is, I think we're ready. It's not going to be easy, but I think we're ready to deal with this when it comes. Thank you.
Thank you, Dr. Cawley. Joe.
I would like to ask Ms. Emily Farr with Labor Licensing and Regulation to come up and discuss their role in the plan.
Thank you, General. Governor. At the South Carolina Department of Labor Licensing and Regulation, we are prepared to support the hospitals in this plan through the licensing and credentialing of qualified healthcare workers to build staffing capacity when and where it may be needed. Since the beginning of South Carolina's first response to the pandemic, the agency and its licensing boards has been working tirelessly to take measured responses and adopt incremental flexibilities to ensure that South Carolina has the resources to combat the virus while still ensuring its citizens are provided with appropriate care and benefit from those flexibilities. So for example, in conjunction with DHEC, the agency waived all state licensure requirements for doctors, nurses, respiratory care practitioners, and physician assistants licensed in another state. This allows additional healthcare workers to come to South Carolina and also serves to expand the use of telemedicine to serve our citizens. We have relaxed regulations so that providers from neighboring states can continue treating South Carolina patients via telemedicine. The Board of Medical Examiners has relaxed regulations related to telehealth to expand availability of medical care. This has allowed doctors, physicians, assistants, and nurse practitioners in certain circumstances to write Schedule II and Schedule III medications via telemedicine without first getting approval from the medical board. It has allowed hospice providers to conduct telemedicine examinations in lieu of traditionally required in-person examinations of patients within 14 days of prescribing medicines for them. It has expanded the ability for the use of telemedicine to treat individuals with opioid use disorder with medication-assisted treatment. We've also expanded access to health care through telemedicine by expanding telehealth to other professions such as optometry, dental, speech language pathology, physical and occupational therapy, and telecounseling for counselors and therapists, to name a few. We have expedited emergency temporary in-state licensure for the Board of Nursing and the Board of Medical Examiners. The agency has also taken measures to help the licensees themselves that are out there on the front line to help us combat this virus. Many continuing education requirements required by professionals are now allowed online. We've extended any renewal or continuing education requirements for our licensees to September 30th, 2020. Given nursing schools full discretion to allow all nursing clinical hour requirements to be done by simulation so that those students could still graduate. We have relaxed other in-person school requirements to allow students to continue the path of earning a professional license. We have also issued practice guidance to licenses from the boards that are provided through links on the website, on the agency's website, to help those practitioners practice safely. All of these measures are available on our website, llr.sc.gov. There is an alert at the top of the page that one can click on and see actions by every board and every area within the agency to help with this pandemic. That link is updated every day as new measures are taken to combat this pandemic. Thank you.
Governor, that concludes.
Thank you.
Yes, sir.
Thank you, General. Thank you, Ms. Farr. Well, as you can see, we have the whole team on the field, public and private. I want to thank these doctors and their staffs, the nurses, the physicians, all those who are on the front line. It's much like a war. They're on the front line. Law enforcement, same goes for them. They're rushing into situations that could be very dangerous to their health. But represented here today and displayed is a large part of the effort that we're making in public health. But also unrepresented today are some you've heard from before, and that's the Department of Employment and Workforce, as well as the Commerce Department, as well as the Department of Mental Health. We know that the isolation that is fostered by these orders and this pandemic are going to exacerbate existing problems and create more. Again, I repeat that we are going to have more and more people that are out of work for various reasons. But we are working around the clock to see that all the resources available to soften that blow, that economic blow, to protect those families, protect those jobs, and get the people back to work when the time comes, are being taken. We are taking measured, deliberate steps. Everything you've seen here so far has been a part of a plan that is working and is expanding, and there will be more steps taken in the future. So, are there any questions for anyone? Yes, ma'am.
Your office has said that you've questioned the constitutionality of a governor's ability to tell people to stay home. What do you think of that now? And I mean, how has your thinking on that evolved?
Well, I think the same of the constitutionality of such orders that restrict the liberty and rights of people that are protected by the United States Constitution. They are there for a reason, and they are there for situations such as this, so that we don't forget. You know, of course, personally, I've been a lawyer practicing attorney for 45 years, several years as U.S. Attorney and several years as Attorney General. But what you can do under the law, what the government can do is, and we're doing that in this situation. We want to be sure that what we're doing is within the framework of the Constitution and the law. And that is to protect the people, having full regard for due process, their rights of assembly, their right to travel, but to stay within the parameters and the guardrails that are set up by the Constitution. We have a South Carolina Constitution as well. There's a right to privacy. So what we're doing is limiting the impact of what we're doing as much as we can in order to protect the health of the people that we know is protecting their health, without going beyond that and destroying more that we are protecting, while still sticking with the mandates of the Constitution. So the evidence and the facts that have been referred to today, that is the rising non-compliance, the rising infection rate, such things as the CDC now in the last few days recommending face masks, such things as about a week or so ago, the CDC declaring certain states travel advisories, in certain domestic travel advisories in certain states. All of those things are leading to a point to where it is within the Constitution to use limited need, don't go any farther than necessary, to protect the liberty of the people without depriving them of their rights. And that's what we've done today. I'm confident that what we're doing today is legal, Constitution, and is similarly protecting the people without destroying families.
As a follow-up, yes, ma'am. Why not just call it a stay-at-home order? You called it a
well, it is. We've been urging people to stay at home from the very beginning. We've been urging. We've had it on 77 signs that we have on the highways. I think we've said that in this is a stay-at-home order. You call it what you like, but it says stay at home. Work and home. Home and work. Those are the places, those are the best places to be. There are certain other exceptions that are good for the health of the people, but will not endanger their health. Those are the things that we've been espousing and promoting from the very beginning. Yes, ma'am.
Governor, you encourage churches to do their services online. Well, a church in Charleston held a service yesterday of more than 100 people who were not social distancing. The pastor said it's his constitutional right to keep it open until the governor says otherwise. Are you going to ask to stop the service? Why or why not? And does this constitute a danger to the public safety?
I can't speak for other governors, but this governor is not going to intrude on the First Amendment. That is an absolute right. We are encouraging pastors and others in any house of worship, any congregation of any kind, to use social distancing. That is, go online. Peggy and I go online with the First Presbyterian Church in Columbia. It's a little different because you don't have the whole choir singing, and there aren't but 3 or 4 people in the church. It's a big church, but it works. It's good, but do it that way. Or have the service outside with social distancing, or if you must have a congregation under a roof, then use that social distancing. But that First Amendment right is very important, just like the others, and we're respecting that.
Governor, how are you all expecting to enforce this new mandate for folks to stay at home?
It is a crime to violate it. It is a misdemeanor, punishable. It is a crime, punishable by 30 days in jail, up to $100 for every day of violation. Law enforcement, any law enforcement officer can enforce it, just as any law enforcement officer can enforce the 3 or more rule. That is, if there are 3 or more people that are congregating that are in one way or another or violating endangering public health or the public order, they can be arrested and go to jail and pay a fine every time they do it. Same thing on the water. We had, just in the last weekend, we had Department of Natural Resources was out in force on our waterways, which I mentioned earlier. They busted up over, I think, 2,500 boats that were out on the water and gave a number of citations as well. Ladies and gentlemen, we got to follow the rules. We know what the rules are. They're clear. The orders we've issued are clear. What you've heard from these people today is clear. We have to do it. If people do not comply, then we'll take the next step, and we'll take the next step after that, if necessary, to protect the people. That's what we'll do. We're not going to violate the constitutional rights, but we are certainly going to protect the people with the limits of the power and resources that we have.
Governor,
yes,
at what level do you want to see motor traffic actually be in the state? What percentage of the normal amount?
You can get the percentages of what's happened in the last weekend from the Department of Transportation. That was part of our consideration for today, where in some places, some highways, not interstate highways, but measuring the other highways, the traffic actually went up over what's usual. Went up 25% in some places. Well, that tells us that there's a level of non-compliance. People must be, they're traveling, they're moving around. Those kind of things added to this increased, increasing incidence of the reports, and those are just the ones that we know about. That doesn't count those cases out there that we don't know about. All those things added together say that we have to do something. Precise percentage, there is no precise percentage, but we want to see it go down. We don't want to see it go up. We want to see the people that are reducing their interaction with others and the chance for contact and spread of disease to go down. And that's what must happen if we're going to stop this fire. It's easy to do. All you have to do is follow the rules that we have laid out, follow the rules that we've discussed every time we've been here, including stay at home as advice and now stay at home as a mandate punishable by law under the rules that we're announcing today. If everyone will do that, will be serious about this and do that, then the rate of infection will be reduced. Perhaps we won't get to the worst case scenarios that we're talking about and prepared for, by the way. We've been preparing for this for weeks. This is a part of our plan. Maybe we won't get there. We hope we won't get there. But if people don't take it seriously, we will get there. Yes, sir, in the back.
Arenas were mentioned as possible surge hospitals.
I'm sorry, say what?
Arenas have been mentioned as possible surge hospitals. Have arenas like Colonial Life Arena been contacted?
Everyone has been considered. We've had people volunteer. I think the plan that has been announced, I don't know if that includes any arenas at this point.
We are certainly looking at those. We've assessed to date 18 facilities around the state, and these facilities that have either been the owners or those that operate facilities either come forth and says these facilities would be available, or the facilities that the state has some type of operational control over. We look at each facility and we have to vet it against certain criteria. We're utilizing the Army Corps of Engineers, and they're doing this throughout the country now, but we're utilizing some guidelines that they have in place. We're using engineers from the Department of Transportation, from the National Guard, and from the State Guard. The facilities generally have to be ADA compliant. They have to have an adequate restrooms and shower facilities. However, we can contract and put those in place if that's necessary. They must have appropriate fire suppression systems. They must be free from lead and asbestos contamination, and generally all hotels that we are looking at that are built after 1990 meet that criteria. And they have to have emergency backup power. And we can also contract or have that type of resource made available. But we're working throughout the state. We're looking to have in each of those areas identified earlier at a minimum one Tier 1 and one Tier 2 facility, but we will certainly expand those as needed to accommodate what we believe may be spikes and surges, but we will look to see where we need those facilities built. We also have at our disposal basically hospital tents that are available to us. The state is contracting for 100 hospital bed tent, and through DHEC they have other hospital tents that can help expand that capacity. That's a fairly quick turnaround that we can identify an area that may need some immediate assistance, and we could have that up and operational fairly quick. Any fixed facilities, we'll be working through the Corps of Engineers to determine what those needs are, and those will take the greatest lead time, so we'll be moving quickly to determine where those will be and get started on those facilities.
Who's going to staff these hospitals?
Did that answer your question?
Do you know if Colonial Life Arena is one of those that have volunteered?
I don't know specifically of Colonial Life, but we have had a number of facilities throughout the state that have offered up, and we will be conducting assessments throughout the state over the next few days to determine what our needs are and capabilities are based upon the plan.
Any more questions?
Yes, as a follow-up to the shuttered hospitals that you might reopen, which hospitals are we talking about, and will those be solely for the Tier 1 self-care, or how will they be used?
We have 4 facilities that were recently shut, when I say recently, over the last few years. 2 of those facilities are not going to be available to us due to either having been repurposed or we found unacceptable levels of mold in one. The other 2 will be continued to be looked at, and no final decision at this point has been made on whether we will use that as part of this plan.
Can you say which 2?
Excuse me?
Which 2?
I think it's the Fairfield and the Marlboro that are still potentially on the table.
Any more questions for the general?
Yeah, who's going to staff these hospitals when they open up?
The staffing as identified by Dr. Cawley, all of this will be done within the framework of the current hospital system. Any support type needs that may be necessary to build up these external facilities, assets such as the National Guard could be available to help with that. We can contract some of those facilities or some of those capabilities as needed, but we will work within the framework primarily of the existing hospital systems for the actual care itself. The other support systems that are necessary to run a facility may be brought on by other capacities, the Guard or contracted.
Is the 3,500, that's a worst case scenario for the state?
That is a mid-range projection, and we will continue to look at projections each and every day as we look at that. And our system is scalable, and if you look at that number, based on the current availability of hospital beds, we are confident that we can meet that, but we want to have that contingency available in case those numbers do exceed what we are currently planning and working against.
You mentioned the 9,000 beds by May 5th, so is that that is when the 3-tier program will go into effect?
Well, we are actually have started that now. When Dr. Cawley mentioned what they have done at MUSC, that process has already started. And all of the facilities around the state have been actively working to enhance their capability to expand within their current footprint. And I talked with Mr. Thornton Kirby with the Hospital Association and with Dr. Adams. Just want to point out this is not an unusual operation that our hospitals do. In the past 5 years with the hurricanes that we've had, this type of plan has been used before. What we're doing different here now is just using some additional facilities to help expand on that footprint. For planning purposes, we'd like to have these tiered facilities within a reasonable geographic space of the primary hospital. And for planning purpose, we've used 5 miles, but that number was just arbitrary to get us started. But certainly as the needs may exist and what the hospital is better capable of supporting, we will adjust our plan to suit those needs.
Any more questions for the general?
The 35.
Right here.
Go ahead, Sean.
Well, it's actually sort of a joint question. We're talking about needing a lot more medical staff, and we're gearing up, and yet we're being told that hospitals are laying nurses and other people off. So how are we going to staff these geared up facilities?
Well, I can speak on behalf of MUSC only at this point. It is true that this event, this COVID-19, is affecting the entire economy, and it's affecting hospitals and health systems in 2 ways. That in one way, we're being dealt with significant financial challenges, and another way, we're having to deal with the large surge of patients coming. At MUSC, we're going through this adjustment right now. It is not, what we're doing, the adjustment we're going through, will not affect frontline nurses, frontline doctors. What we're doing to make that adjustment is particularly support staff that at this point in time we feel don't need to be part of that surge. And so those are the staff predominantly affected. So once again, I'll just reemphasize, this is not affecting frontline nurses, nursing techs, respiratory therapists, or anybody that provides direct patient care, including our doctors as well.
So those staff members would not be laid off or furloughed?
That is correct. But those staff members have already been affected by this, right? And they've been affected by this because of the great decrease in hospitalizations, surgeries, ambulatory visits. They typically flex to volume, and they have been affected in that the number of shifts they may be covering in the last 3 weeks has greatly decreased. Now, that may be okay because in the next 4 to 6 weeks, they're probably going to greatly increase. So there's been this period of time where the number of shifts that they typically work is down, but it'll go much higher in the next 4 to 6 weeks.
Is it possible then they could be hired back after very temporary layoffs?
Well, I'm going to reemphasize, we are not laying off, not at MUSC, we are not laying off frontline workers. We're not laying off frontline nurses, nursing techs, respiratory therapists, doctors, anyone that works on the front line taking care of patients, we are not laying off.
Can you give us some examples of who is being laid off then, for the lay folks who don't understand who consider what's considered frontline?
Well, there are often people in the background that work maybe quality work or some registries in the background, billing folks, things like that. Things that are often in the background that during something like this where we have to prioritize patient care in an environment in which we must be fiscally responsible, we have to prioritize frontline workers.
Any more questions for Dr. Cawley at the moment?
Question for Dr. Osman of Prisma Health.
Doctor?
Where does Prisma Health stand on the COVID testing backlog, or is that caught up?
Our testing is very caught up as of today. We're working closely with DHEC, our internal labs, and then also with some of the private labs. So we feel pretty confident today that we're caught up on the vast majority of that testing.
Are there any more questions?
Yeah, so for him
Yes,
or for
in the back.
Yeah, Governor, the South Carolina got pretty much everything it asked for out of the federal stockpile. Is it good to have a friend in a high place? I mean, why do you think South Carolina, while some other states didn't get as much, why do you think South Carolina kind of got everything it asked for?
Well, we've been asking for everything that's available. Of course, it is all, the way it is sent out is by population generally and also including need. There are factors. But the administration, the Trump administration, is working overtime to get factories and producers to come online and switch from one thing to another. And we have a lot of them right here in South Carolina that'll be announced, if they haven't already been announced, to people that are coming over and making masks and face shields and tests and all sorts of things. It's an across-the-board effort, but we talk with the federal officials every day. Someone in our group is on the phone probably at every minute during the day talking to the federal officials, being sure they know what our needs are and that they are sending us everything that is within their power. But a lot of the things that we need, we must get from the private market. And therefore, we just like everybody else, just like the hospitals. We don't just get it from the federal government. So I assure you that our team is working around the clock to see that whatever we need, we get. You remember a year or so ago, the DHEC lab ran out just about of the reagent that's used for the test. Well, we ended up, we got busy and made that need known, and overnight we got the reagent that we needed. So our team is alert, and everything that is available out there, whether it's medical supplies, personal protection equipment, unemployment benefits, loans for small businesses, loans for sole proprietors, loans for 1099 or unemployment for those people, 1099 small businesses and others that are usually not a part of the unemployment scheme. They are now. And we are working to be sure that the administration, those in charge of those federal agencies and regulations know what we need here. And we are working vigilantly with our congressional delegation, Senator Graham, Senator Scott, all the others, to see that anything that is available, we will get.
Dr. Osborne.
Yes, right here. Hold on.
You've made an order to close non-essential businesses, but gun stores have stayed open.
I'm sorry, say what?
You've made an order to close non-essential businesses, but gun stores have stayed open. Why are they considered essential?
because there's a constitutional right to have and bear arms. That's the Second Amendment.
Another
Yes,
staffing question. Are we losing a lot of nurses, the frontline people, to New York and other places that might be paying more right now? And if so, are we tracking that?
We're not, as has been explained, we're not losing, but I'll let these gentlemen answer that question.
We've seen some nurses and doctors go. I think they're wanting to go to a place where at the moment they're needed. So we've seen some low level, but I wouldn't say large numbers at this point.
Dr. Osmond, can you comment on what types of staffers at Prisma have been furloughed? Are they nurses?
No, I mean, we're really in the same position as MUSC. None of our frontline doctors, nurses, technicians, people that are going to be providing care. I mean, this is a challenging time for healthcare, but, you know, we're taking the exact same approach that MUSC is.
Is it impacting your readiness, having those people laid off?
I don't believe it's affecting our readiness. I mean, our frontline staff remains intact, committed on the job, and it is not impacting the readiness at all.
Do you have any layoffs or any other furloughs planned?
Sort of out of my lane.
Governor McMaster, when will benefits from the CARES Act be available to folks?
Which one is the CARES Act?
That's the one where they file for unemployment and they are able to get those benefits.
That's the $600. There's the $600. Regardless, you have the Coronavirus Assistance Act, and then you have the various acts. But the $600 per person for unemployment insurance was not available until I think it's just started now because of requirements that had not been met in Washington for the dispersion of those funds. But that's being met now, and those checks, that money will be added to everyone's unemployment check who files for unemployment under the state unemployment system. Now, for others, the $1,200 per person, that is automatic under the from the Treasury Department, but you have to be known as a taxpayer. If you're not a taxpayer, then you can file as a taxpayer. You need to hurry up and do it. If you haven't filed this year, because the extension's this year, but if you haven't filed yet this year, then what they will use is what was on the books last year. And that if you have a deposit account, then it'll go directly into your bank account. If you don't have one, you're going to have to write they'll have to send you a check. That's going to take a little while. All of those things are being handled. There were some restrictions and rules that had not yet been thought out and finalized in the government, the federal government, but they are now, if they haven't been, they are being and will be very soon. So those checks should start flowing immediately. We were working with Director Elsie, Department of Employment, Workforce, and Department of Commerce. We were preparing to see what we could do ourselves in order to try to help fill that gap. But now the checks, the money, the support should be coming. And I say again, there's ample avenues open. I urge everyone who's interested to go to those websites, the Department of Commerce, Department of Employment and Workforce, and look at those. And there's also loans coming through the private banks as well for small businesses. Yes, ma'am.
Questions if there are.
Ma'am?
MUSC question. Are you still doing non-necessary surgeries to keep the cash flow coming in, like gastric bypass or other things that could be postponed?
We've postponed anything that can be postponed. We are only doing, at this point in time, emergent surgeries. That means emergencies. And we're doing only surgeries that we call urgent, less than a week. Meaning if it's not an emergency, but it should get done in the next week, we are doing it. What we're also finding, though, over the last, because this has been going on 3 weeks, we have a third category called urgent, less than a month. We are starting to get into that group. We're trying to push that off. But unfortunately, this has gone on long enough that we're starting to see those. Anything over 4 weeks that is elective, we are not doing.
I have a question for Dr. Bell. Dr. Bell, what can we expect in the coming weeks? I know the Surgeon General has put kind of a grim outlook for the next 2 to 3 weeks for our nation. What specifically can we look for in South Carolina? What are the projections there?
Well, we have projections, but it's very, very difficult to really answer specifically what to expect. Our projections have already been commented on that are based on a variety of models. We're looking at everything from projecting out case reports based on who's been tested. We are looking at projections based on what other countries have experienced in a recovery phase. And so our preliminary projections based on one particular model suggest that we may see a peak in deaths in the first part of May. And from that information, it gives us the ability to estimate hospitalization use, intensive care unit use, and ventilatory use during that period. So what that actual number is hard to define because it's based on a range where there's a worst case scenario and a best case scenario. And as General McCarty has already commented, a range approximately in the middle of that has been selected for this hospital planning.
Dr. Bell, what's the status of the database for
This
law?
has to be the last question.
What's the status of the database for law enforcement in terms of where COVID-19 cases are?
Director Davidson will answer that.
Thank you, Governor. You're correct. We are working closely with our local partners, law enforcement, emergency management partners, I'll say. We started during this last weekend process through which we can enroll them electronically. And depending upon the type of system, there is not one 911 system around the state. There's many different types of 911 systems. And so some will have access through a query method, internet-based query method, where at a 911 station, if they are responding to an address, they can enter it and they can be told, yes, that's a recent COVID a residence where there was a recent COVID positive individual, or no, there was not at that same address. There's also a model that we're pursuing. We have several counties that we're trying to work to pilot this with. And so in addition to the 911 center model, there's also a model where the responding unit could do the same thing and provide a query. And then there's also where the larger counties, the counties with more 911 capabilities would be able to have a system that would more directly integrate with their CAD-based 911 system. So we have several models that we're working simultaneously. Throughout this week, we'll be piloting with several counties, and as the week comes to a close, we should be in end of the week and into the weekend beginning to share with all counties that data electronically, but also I must urge in a very secure way, so that we're not just handing anybody a list per se. It would be through a query-based system for those that have a need to know.
Governor,
One
more simple question for you. Have you been tested for the virus yet?
No, sir.
Okay.
I have not exhibited any of the symptoms. I'm following the protocol. I want to thank all of you for coming. Particularly today was focused mainly on our medical and health response. We appreciate the work, and please tell the doctors and the nurses and all the rest how much we appreciate what they're doing. Also, I want to remind you that law enforcement and the first responders are really in a situation where they have to rush into danger, not knowing what they're going to find. We're trying to solve that problem, as Mr. Davidson just mentioned. But for the ladies and gentlemen and the citizens, the mamas and daddies and children, we're doing all we can, and we're thinking every day of the people of the state. I want to remind people that it is the elderly that the facts, the science, and the data show are more susceptible to this. Those older people, particularly those with underlying conditions, the highest percentages of those up in the 90% range, those are the ones that are succumbing to this illness. So I'd like to urge everyone to be careful about your mama, your daddy, your older people. Be careful about them, and remember that the social isolation involved in this, as it increases as we go along, the social isolation has an impact on people. And that's why our mental health community is standing up. I assure you finally that every resource we have in South Carolina is thinking about nothing but the health and safety and the future of the people of South Carolina. And we thank all of you for being here again today.